Hello, friends. Welcome to the Wellbeing Show. This is Reshmi, and today we are back with another episode where we will discuss menopause caused medical condition known as arthralgia. It's actually a symptom that mainly affects the joints. And to discuss this in details, I would like to invite Dr. Maureen Tigga. Friends, if you have been following us from our previous episodes, you might already know that Dr. Tigga is a member of the Menopause Society of India, and she has been giving wonderful insights and knowledge on other menopause caused issue medical conditions in the other episodes. So if you haven't watched them, go and watch them and subscribe to my channel for such interesting episodes in future. So, welcome Dr. Tigga to this another interesting episode that's going to unfold. And my first question for today is arthralgia, or you can say in general, like we have muscle pain and joint pain. Is it only affecting women who are going through menopause, or can it also occur in usual conditions in general?
Well, thank you, Reshmi, once again, and hello to the lovely audience. Before I proceed with your question, I would like to take some moments to make a correction. In my last recording on sarcopenia, I mentioned muscle pain as arthralgia by mistake. It was just a human error. So, muscle pain is known as myalgia, and arthralgia is simply the joint pain. So, today we are talking about the joint pain. And coming on to your question, that can arthralgia, that is joint pain, occur only related to menopause, or can it occur otherwise? The answer is that yes, arthralgia can occur in other cases as well, because arthralgia, as you rightly said, is just a symptom, and it is just a telltale sign for an underlying cause. So that underlying cause can be if there is injury to the joint, or there is trauma to the joint, and that can manifest as pain, or it can be due to damage to the cartilage of the joint, which is seen in cases of osteoarthritis, or it can be seen as you mentioned, that related to menopause. Now, why joint pain happens in menopause? This is because in menopause there is a decline in estrogen, and the hormone estrogen is known to have a protective effect on the bones and joints. So, because of the absence or decline in estrogen, there is there is stiffness in the joints, there is decrease in the lubrication in the joints, and that manifests as pain, which is known as arthralgia.
All right. Is it true, Dr. Tigga, that arthralgia is one of the most common symptom caused by menopause?
Yes, absolutely. Because studies have shown that more than 50% of women who have attained menopause will report some kind of joint discomfort or joint pain. And this especially is seen in joints like your hands, necks, shoulders, and lower back, and your knees. So that's true.
Okay. Mm-hmm. So you already mentioned the causes to arthralgia. So can you please tell our audience what are the diagnostic tests and measures available to detect arthralgia?
There is no single pinpoint test to test that why arthralgia is happening, because as I said, that arthralgia is just a symptom, and we have to detect the underlying cause. So there could be a range of tests which a doctor can advise you, and one being that the calcium and the vitamin D levels to see how your skeletal system is functioning. Then there could be anti-inflammatory status is what leads to the health of your joint. So when your body is producing inflammatory substance, that may lead to joint pain. So that is detected by ESR or a blood test which is known as CRP. Then also, if we find that the underlying cause of joint is related to underlying cause of joint pain is related to some damage to the joint, then imaging techniques are advised, like your X-ray or an MRI. And in general, in menopause, one might even advise to get the hormonal profile done to see what is the status of your estrogen and the other hormones. So these are the tests.
Okay, okay. Um, is it treatable and can it be cured 100%?
Well, Reshmi, the right word would be that is it manageable? So, yes, it can be treated and it can be managed if we take the right approach. And that approach involves your lifestyle changes like an exercise and diet. If you exercise, if you keep yourself active, then your bones and as well as your joints and your muscles are in good shape. And that is how we work on the health of your bones and joints. Then your lifestyle changes also includes a healthy diet, which includes more of healthy eating, your anti-inflammatory items like your omega-3 fatty acids and green leafy vegetables, and avoiding the junk. Then hormonal therapy can be advised to some women, where we find that the depletion of estrogen has led to extreme of symptoms. So there, even hormonal therapy, where indicated, can help in your maintenance of joint health, as well as other things which is advised is the first line step is to give pain relief, that is through analgesic drugs or certain ointments which can help as local relief. And of course the supplements, because for bones and your joints, calcium and vitamin D is very very important. So taking these supplements will also help you to manage your joint pain.
Okay, okay. So, what are the common myths associated to joint pains?
I'll take a few myths which are associated to joint pain. So, the most common one is that many people think that joint pain means that you have arthritis. What is arthritis? Arthritis is the inflammation of the joint, and arthralgia is the pain symptom. So, not every joint pain means that your joints have gone into inflammation. It can be due to trauma, as I said, it could be due to injury to the joint. So, not always that it is arthritis, and not in menopause, it is not always true that because you are having joint pain means you have landed up in arthritis. It could be some other cause as well. The second myth is that exercise worsens my joint pain. This is the biggest, roadblock which people have in their mind towards exercise. That already my joints are paining, and if I move, then I'm going to put pressure and I'm going to strain my joints much. But on the contrary, paradoxically, the movement actually opens up your joint and it improves the flexibility, and that reduces the pain. So this is another important myth which I busted right now. And the third one is that nothing can be done. It is just a part of aging process. This is just like giving up to your natural cycle. No, it doesn't work like that. False. Menopause associated joint pain can be managed, as I told you in the few tips which I mentioned just now. And with proper care, your joint pain can be greatly improved, and your motion, the way you move, your whole skeletal function can be taken care of.
Perfect. So those were amazing mythbusters from Dr. Tigga. You already mentioned some of the lifestyle measures that one can take to combat this. Are there any other simple practical measures
Yes, first.
that you'd like to mention?
Yeah, sure. I would just want to reinforce that, please, the myth which I busted about the exercise. Most important lifestyle tip to manage arthralgia is to stay active, which includes strength training. In my last talk, also, when we were talking about sarcopenia, see, why would your joint pain? It is because when the joint is not aligned and it is not well supported. What happens in menopause? We discussed in our last talk that sarcopenia comes into picture, and when you're losing your muscle. So, how else do you strengthen your muscles? It's through the resistance exercise, which I told in the last talk. So while resistance exercise is a part and parcel of your regime, you should also include low intensity exercise where you don't have to work much. Only the muscles have to move and the joints have to move, and that can be incorporated with simple yoga as well as swimming. You don't have to go and lift weights for your joint pain. You just have to do a simple low resistance exercises, like swimming can also help, yoga can also help. The second thing is eating proper diet, and most important is to include anti-inflammatory foods like fish, nuts, turmeric, and green leafy vegetables, and your supplements which are available. Third thing is get your daily dose of vitamin D. Please step out in the sun, and also stay well hydrated. That provides lubrication to your entire body. The body, human body is made of 90% water. So the more you are hydrated with water, you are doing good to your overall, the entire cells which are present in your body. Then the third thing is maintain a healthy weight. In my last talk, while I was talking about sarcopenia, I told you how paradoxically, when the muscle is lost, it is replaced by the fat cells. So your body has gained weight, but actually that is not the muscle. It is the fat which is putting on your weight, and that is also in putting stress onto your joints. So maintaining a healthy weight also helps in your relieving your joint pains. And last but not the least, please keep moving and please don't stay still. Please get that thing out of your mind that if I move, my joint pain will worsen. No, paradoxically, it will improve. So these are all my tips in a nutshell for healthy lifestyle and how to combat arthralgia or how to cope up with arthralgia.
They are such useful tips, Dr. Tigga, I must say. And I'm sure the audience have learned a lot about the myths surrounding joint pain, which is actually very interesting to know, and also what one can do in daily life to overcome these minor issues and avoid them from growing into something more serious in the future. So to keep watching similar, interesting, knowledgeable, pure content oriented episodes for future, subscribe my channel, please support us. And if you have any interesting topics or questions you would like to address in this channel, please, I welcome you to share that with me. So thank you for today. Thank you, Dr. Tigga, for your insightful information and knowledge. And until then, see you for next time. Bye bye.
Thank you and have a good day, everyone.
Bye.